Okay, good evening and welcome to our first annual virtual graduation. This is a great tradition in the Department of Surgery. Of course, all kidding aside, we're thrilled to have everyone, a few here in Cullen Auditorium and a large group online virtually. Obviously, very unusual circumstances, but my thanks first to Holly Shillstone in particular and the entire education office team, Rob and Dr. Scott for pulling this together, and I'm sure this is going to be as meaningful an event as it always is. So let me begin by saying that hopefully the silver lining of this afternoon is the many people who are joining us virtually that might not otherwise have been able to do so and participate in the celebration of our class of 2020. Today, we celebrate our graduating chiefs and fellows, our COVID chiefs, and we also hope that this will be a very, very unique occasion and perhaps, hopefully, one of a kind. In thinking of the challenges that the class of 2020 have faced, from confronting a disease never seen before to navigating a virtual graduation, one can ponder the maxim, I wonder how I would do in circumstances that are beyond extreme. These challenges that our COVID class has faced have been many: care of intensely ill patients, concerns for your own well-being and that of your friends, families, and colleagues, safety in the most unusual of environments, the stress and frustration of seemingly constant changing landscape where the rules are different every day, expectations that change, again, almost on a daily basis, and the challenges of social isolation, concerns for professional and even economic safety, and even external environment that we've seen of unrest that have intruded on what is normally the safe cocoon of the medical community. These are all things that none of us would have ever expected to face. Not exactly what we would have envisioned as a graduation present. For our chiefs and all of us who have been challenged by these circumstances, though, far beyond what we could have imagined, the answer on how would we perform under such circumstances is now in. And we can say with the certainty of this bizarrely real world that we face that it as an affirmation that our faculty, our staff, and most particularly today, our residents, it is comforting to know that given these challenges, your performances were exceptional. They were selfless. They were auspicious. And with our graduates' innumerable ways, you showed that great leadership that we knew you would have, but you showed it to us in a way that was not imaginary, but real. For that, we can only say thank you. We expected no less, but we're very proud of you for what you showed us. The strength of your ethos, your mettle, and how you performed is truly exceptional. And the silver lining, one of them, of the COVID crisis, that you will always have this memory of how you performed when called upon in the most unusual of circumstances. Thank you to our chiefs and our graduates for your leadership and for setting a standard for which we will all be very proud for years to come. Skill, astuteness, flexibility, and most importantly, resilience are invaluable traits for all achievers, not least of which are the surgeons that you have become. You, our graduates, have displayed these traits with great flourish, not only over the past 4 months, but over the as many as 7 years that we have been fortunate to count you as members of the Department of Surgery family. These traits will continue as the years go by in years to come with great support and will be the benchmark of your great success, which we will know you will show us. When the inevitable times come, when you may doubt the presence of these strengths within yourselves, I hope you will look back to these days at Baylor in the Michael E. DeBakey Department of Surgery as a reminder how far these assets can and have carried you. We here will always be a reminder of that and will always be a resource for you in those moments and hopefully at all times as members of the Michael E. DeBakey Department of Surgery family. As we have said before, I share the sentiments of all our faculty in expressing my appreciation for how much our graduates have grown over the course of the time you have shared with us as the mature surgeons that we see today. Some of you joined us as very young sprouts right out of medical school. I suspect if you think back to those early days, you too can appreciate how great has been your growth over these years. Well beyond your development of diagnostic, therapeutic, and surgical technical skills, you have grown as proficient and supremely mature and thoughtful physicians. We are honored to have hopefully provided the role models that have been indispensable in helping support that maturation, and trust you all will do the same through your careers. Thank you in your advance for continuing that legacy, which of course extends back to the great traditions of DeBakey and Cooley, and continues today with our many faculty who continue the tradition of these iconic figures in surgery. So suffice it to say, as we will hear more later over the next hour and a half, that we could not be more honored nor more confident that you will continue to make us proud in the years to come, as surgeons, as physicians, as colleagues, and as peers. Thank you. Congratulations on your accomplishments and our sincerest best wishes for your continued success and promise. Thanks as well again to our education and faculty support staff led by Holly Shilstone, Jay Chambers, and Dr. Brad Scott, Dr. Eric Silberfein, Dr. Vera, Dr. Ganta, all of our course leaders, program directors, Dr. Caselli, and the like, who have led our department in our mission of educating our trainees. We could not be more grateful. We wish you Godspeed as you continue on your journeys, and we thank our graduates for the time you have spent with us. Thank you. With that, I'd like to turn the program over to Dr. Scott. And again, congratulations to all our graduates. Brad?
I guess we don't clap. Yeah, exactly. And I'd like to congratulate all the graduates and all the people that are present here and online. I hope the medium that we've chosen does not blunt our message for tonight. First off, just congratulate the education administrative team. These are the people that have gotten you through, the people that carry you along during your residencies and your fellowships. Holly, Jay Chambers, Josephine, Allie Bremer, Amy Silva, Morgan Fields, and Woods McCormick for our UME program. So next time you see them, either virtually or in person, please congratulate them. So tonight is going to be a little bit different. It's going to be a mix of in live and online. So bear with us as we work out the technical details. Our very first presenter. Thanks for stopping that. So I'll stop touching the computer. Our very first section is the Division of Thoracic Surgery. Dr. Caselli is going to present our first fellow. As soon as you hear your presentation, just if you're here live, please come up, and you have the opportunity at the podium. So thank you.
Davut Sebkimigalagala. I'm sorry, I'm killing the pronunciation, but it's an interesting name. We call him Davut. He's been fantastic. Following in the footsteps of Dr. Denton Cooley, Michael E. DeBakey, E. Stanley Crawford, and others in the Department of Cardiothoracic Surgery at Baylor College of Medicine, who have been pioneers and major contributors to the area of aortic surgery within our specialty. We have an aortic surgery fellowship, and our recent graduate is Davut. It's a year program. Davut comes to us from Istanbul, Turkey, where he is from, but also did his medical school there. He additionally did his general surgery and some cardiovascular training also in prestigious institutions in Istanbul. In the past, he's been a Thoracic Surgery Foundation travel scholarship winner. Also might mention that his presentation entitled Transcatheter Valve-in-Valve Implantation for Degenerated Stentless Bioroutes was accepted as a presentation for at this year's AATS Aortic Symposium, which was supposed to be held in New York City, but it was unfortunately canceled for COVID. He's preparing a publication for that. It's just one of his basically innumerable publications that he's been involved in uh, in his training years, both here as well as in Istanbul. He's a member of the Society of Thoracic Surgeons. He's a member of the European Association for Cardiothoracic Surgery, as well as the Turkish Society for Cardiovascular Surgery. Davut's been an absolutely wonderful individual to spend a year with. He's technically very, very proficient, and he's a very knowledgeable person. Equally as importantly, he's kind and very interested in patient care, not only in the preoperative development of the patient's operative situation, as well as in the operating room and post-operative care. He's an enormously curious individual, constantly looking into the nuances of the various aspects of cardiothoracic surgery, but in particular aortic surgery. And I really want to congratulate him for spending a really terrific year with us. Davut's going to stay with us for another year here in the Department of Surgery and spend a year as a fellow on with the General Thoracic program, expanding his knowledge in surgery of the chest. And I'm sure he's going to be a valuable contributor to their division, as well as in the Department of Surgery. Congratulations, Davut. We're extremely proud of you and proud of your entire family.
Baylor College of Medicine, Department of Surgery, which is representative of excellence in the community of surgery. I would like to start to thank with Dr. Kosali, of course, with his very kind words, but more importantly, for the opportunity that he gave me to train under his mentorship and leadership. I will be grateful entire my life for the inspiration that I got from you. Thank you, sir. And then I would like to thank the other, my faculty members in aortic surgery program, Dr. Perens and Dr. Orozco. They help for the training also. And lastly, I would like to thank to my family, my parents and my wife for their indefinite support throughout a long journey. Thank you all. It's again a very honored year for me to spend with you at Baylor College of Medicine. Thank you so much.
I don't know if they can see any of this, but I know we can't hear in the room. I just want to thank you again for a great year. You've made us proud and your family proud. And here's a little, let me look at the top of this thing. Here's a little plaque that they give for this aortic fellowship that you can show here and enjoy, and I'm sure it'll be a nice contribution to your many awards to come.
Thank you so much, sir. Appreciate it.
Texas Harness to Baylor College of Medicine, St. Luke's Hospital here in Houston. Dr. Cooley formed the International Cardiovascular Fellowship Program 50 years ago. Since then, we've graduated over 1,000 international cardiovascular fellows that have come from all over the world and have gone back to performing multiple complex cardiac and thoracic and vascular procedures in their native countries. This year we have 2 graduates. Both are ladies from Iraq. The first one is Mona Alwis. She was from Baghdad, Iraq. She did her general surgery in Baghdad and also did a fellowship in obstetrics and gynecology. She did an excellent job for us, and now she's going to continue on her education, and she's enrolled in a residency program in anesthesiology at the University of Iowa. Our next fellow is Dr. Sudad Al-Haddad. She is also from Iraq. She did her general surgery residency at Diyala, And she also did a fellowship in gynecology and obstetrics also. She did a wonderful job for us. She's going to continue on and work in the pain management division. And so we wish both of these fellows the best of luck, and they did it. They did a wonderful job. We're very, very pleased.
This is an extremely important day for all of our graduates. Every one of them has done an absolutely fabulous job. Their parents, their family, and their friends have to be very, very proud of their accomplishments in this break in the road to their certain to be absolutely spectacular careers and futures. We have 4 graduating thoracic residents. Just say thank you also to the thoracic residency faculty at Ben Taub, the VA Hospital, Texas Children's Hospital, MD Anderson, and Baylor St. Luke's here at the Texas Heart Institute. All of this faculty has done a fabulous job with this group of people, and they're to be congratulated for all of their educational efforts. The first graduating thoracic resident I'd like to congratulate is Melissa Korb. She comes to us from Rapid City, South Dakota, but went to medical school at the University of Cincinnati and did her general surgery at the University of Alabama, Birmingham, Alabama. She is the first official graduate of our thoracic track in our cardiothoracic training program. Might say that for those of who are not absolutely familiar, we refer to the residency as thoracic surgery residency, but it's both cardiac and general thoracic. David Sugarbaker came to us a number of years ago and helped us establish this thoracic track. He's no longer with us. He is dearly, dearly missed. He was a giant and an icon, innovator and a pioneer in thoracic, general thoracic surgery. Helped establish this track, and Melissa's the first graduate from it. And I think although David Sugarbaker is not with us, he would be enormously proud of what she's done and certainly what she has ahead of her. David Sugarbaker was also the editor of the iconic book that's used worldwide for thoracic surgery. And it was in its 4th edition, and Melissa contributed a chapter on the esophagus, and it's a beautiful piece of academic work. She's also the first lady in our program for many, many years, and I think probably the second ever to become a mother during her thoracic residency training. She's the proud mother of a 4.5-year-old boy, and in addition to her clinical work is, I'm sure, the pride of her life and her family. And what a tremendous accomplishment and an honor it is for us that she's done so well. She's going to move on following her training to join a practice and carry out general thoracic surgery in a private practice group in North Houston as of this recording.
Thank you to my family, my friends, my co-residents, my mentors, specifically Dr. Burt, Dr. Groth, Dr. Ripley, and Dr. Carrot, as well as the nurses and all the OR staff. I can't express enough how much I appreciate all of your time, support, and guidance throughout these 3 years. Thank you all.
Originally had his medical school and general surgery training in Venezuela. This was followed by a cardiovascular fellowship here at the Texas Heart Institute. And then at the University of Texas Health Science Center in San Antonio, he spent some additional training in general surgery. at which time he won the resident teacher and a separate leadership award for his fabulous work there. He's been with us from 2017 up until this summer of 2020. During this period of time, he's had numerous publications, book chapters, presentations.
Thank you, Dr. Coselli, for those kind words. First, I would like to thank everyone, the faculty, staff, the OR nurses, everyone is being wonderful. And I would like to share with you a very personal message right now in these times that we have very important challenges with everything what's going on, the pandemic, COVID-19. There's a time where everyone has to stand up for what they believe. And I'm very proud to stand here and say that here in our department or school, I don't think there's any minority, and I think diversity is our strength. And I'm here standing here because I'm a living proof of that. So I appreciate the opportunity to come here, train, learn, and hopefully replicate everything I learned here. I want to share a message with my family that's connected online. Mamá, papá, toda mi familia, gracias por la oportunidad de estar acá. Basically, I'm thanking them for the opportunity to be here. Thank you so much, and I really, really, really appreciate the opportunity to train and all the patience for the teaching. Thank you.
Did his general surgery at the University of Oklahoma, and also spent some time studying as a fellow in surgical critical care in the Perlman School at the University of Medicine at Penn. He's been extremely active during his thoracic training, contributing not only clinically but also academically. He's been the administrative chief resident over this past year, and from a administrative standpoint has done an absolutely outstanding job. He's an amazing clinical and technical resident. He's really done a fabulous job. He's had quite a number of publications and presentations at the STS and the AATS. Following his graduation, he's going to continue to join us in the department of the Michael E. DeBakey Department of Surgery and be an assistant professor of surgery in the Division of Cardiothoracic Surgery here at Baylor. He's going to be at the Michael E. DeBakey Veterans Administration Center Hospital, where he's going to be co-director of the Cardiac Intensive Care Unit. And I'm sure he's going to continue to do an absolutely fabulous job. Along with his family, I believe the faculty at Oklahoma, as well as those here at Baylor College of Medicine, would really consider him one of the best residents that we've been able to train in recent generation. And congratulations to you, Alex. Fabulous job.
Well, I cannot believe it's been 3 years since starting it here in Houston. It's been a great journey. Training is second to none. And I'd just like to say thank you not only to all the people here in the room, but everyone online who has, you know, those are really the people that have put me here and made this happen. And without all those individuals, this really wouldn't be possible. So thank you to everyone there, and I very much look forward to staying here and joining the Baylor family. So thank you.
Training program is Daryl Wu. Daryl's from the Midwest. He grew up in Illinois and went to medical school at the University of Illinois. Following that, he came to Baylor College of Medicine and has been with us through general surgery and then, of course, his thoracic residency training. I got to tell you, Daryl's one of these individuals. It's an absolute pleasure to have worked with, to have been part of his training and contributing to his education. He is a wonderful individual. He's a terrific technical surgeon. He's done an amazing job. He is a sense of pride for all of us here on the faculty. Since he's been with us, he's been enormously productive from an academic standpoint, in addition to all of his significant technical accomplishments. He's authored no less than 14 publications with us. He was awarded the Best Plenary Session Presentation at the 8th Academic Surgical Congress, the Best Poster Award at the first annual Baylor College of Medicine Cardiovascular Research Institute Symposium. He gave the Best Oral Presentation Award, received the Best Oral Presentation Award at the Baylor College of Medicine Michael E. DeBakey Research Day. He also won the Academic Surgical Congress Award for Best Cardiothoracic Abstract and was a finalist for the C. Walton Lilly High Resident Forum Award for his work on inflammasome. Additionally, he won the Best Basic Science Presentation Award at that year's Research Day. A publication that I'm particularly proud that he worked on with us is Cardiothoracic after thoracoabdominal aortic aneurysm repair.
Dr. Caselli, thank you. I just want to say how proud and honored I am to be a part of the Baylor legacy. And I want to thank everybody who has been involved with my training the past 11 years. Thank you.
So now we're actually going to have the thoracic residents come up and give an award to thoracic faculty.
So the graduating class was asked to honor, or ask who we would like to honor tonight for the main faculty we felt really contributed the most to our education. And we chose an attending surgeon for both the thoracic and the cardiac track. And so for thoracic surgery,
we would like to give this honor to Dr. Sean Groth. Thank you, Dr. Groth, for your constant presence in our didactic lectures and our training sessions with mock orals, and you're always willing to teach and sit down and take a moment to help us better understand the disease processes that encompass thoracic surgery, and for that we are eternally grateful.
and for cardiac surgery, we chose to honor Dr. Joseph Caselli this year for everything he's contributed to all of us over the past 3 years.
Well, thank you. Let me extend also my congratulations to all the graduates, and to tell our 4 graduates this year that I'm extremely proud of the cardiothoracic surgeons that you've become, and I'm thrilled to see that you're joining our fraternity of cardiothoracic surgery. You know, I've been asked to present an award that we give out every year called the Thoracic Surgery Scholar Award. This award is given to the resident who consistently performs the highest on our annual National In-Service Training Award and also on our semi-annual mock oral exam. This year's winner has consistently performed in the top percentiles nationally every year of the residency program, and his dedication to reading and academic work is reflective in his performance on this exam. This year's winner is Dr. Alex Schutz. Alex, you get the award tomorrow, I heard.
So that concludes our live portion of the evening. We're now moving online. We'll move to our division of plastic surgery. We'll start with our first graduate.
And Pediatric Plastic Surgery Fellowship. I have the distinct honor and privilege tonight to introduce our 2019-2020 Craniofacial and Pediatric Plastic Surgery Fellow, Dr. Amy Zhu. I've known Amy since my first day at Baylor College of Medicine. In 2011, Amy was a research fellow in our clinical research lab in plastic surgery. Her work ethic, her character, her integrity propelled her to earn a position in our residency program. And then she subsequently wanted to continue her craniofacial and microsurgical training. So we created a special fellowship where she worked with Dr. Klebeck at Methodist and with us at TCH to do a pediatric craniofacial and microsurgery fellowship. We love Amy at Baylor, and we want her to stay with us. And so we have given her the greatest compliment any fellow could get, a job. And so she'll be joining us at TCH as well as at Methodist. And I also want to extend Amy the pediatric surgeon's compliment, which is I would allow her to operate on my children any day. We have that much respect and admiration for Amy. She's a special person, and we're all blessed to have her with us at TCH and at Baylor, and we look forward to where her future brings her. We know it's going to be very bright, and we just look forward to seeing that in person. So congratulations, Amy. Thank you for all your hard work and effort, and we look forward to seeing you in the near future at TCH. Take care.
It's been an incredible journey for me these past years at Baylor, culminating in such an amazing fellowship year at Texas Children's and also Houston Methodist Hospital. So thank you in particular to Dr. Ollier, Dr. Klebeck, and Dr. Buchanan, my fellowship director, for making this year so special. I hope when I submit my case list in a couple of days, you'll be really proud of the case volume and the variety our program has to offer. And thank you to all the faculty and the residents these past many years for teaching and working with me. And of course, thank you to my family for their unwavering support. Finally, congratulations to our outstanding chief residents, Christy, Daniel, and Nikhil tonight for your graduation. I look forward to seeing many more wonderful accomplishments to come. Congratulations again. Thank you.
I'm Hinata Maricevic, Program Director for Plastic Surgery, and it's a great pleasure to introduce Dr. Nikhil Agrawal. Since his first year, he has been a hard worker, focused, and extremely well-read resident. He's a great surgeon, but mostly a doctor, who comes well prepared for every case because he just cares about his patients. Nikhil, best of luck in your hand fellowship in Boston.
Hello. First and foremost, thank you to the patients of the beautiful Texas Medical Center. I've had the opportunity to treat the population of Ben Taub, where 70% of our patients consider Spanish as their first language. The rich and famous getting cosmetic surgery at our private hospitals, the veterans of our great country, and of course those at Texas Children's Hospital, where the patients have so much promise and hope. At all of these locations, my prominent faculty have taught me not only about technique, but also to treat every patient like a family member, despite social differences. For this, I'm eternally grateful. Residency has taught me the perseverance that is required in the face of the kind of adversity that surprises you at 2 p.m. on an idle Tuesday. It could be a bad trauma, a complicated patient, a sick family member, or even the loss of a beloved faculty member. There are good times and bad times, but the village around you will get you through all of it. Thank you to all of my families who have shown me so much love and made life outside of the hospital all worth it. Thank you to my wife, who came with me to Baylor 6 short years ago to start this amazing journey. She is my harshest reviewer and then subsequently consoles me after getting a harsh review. She reminds me to be nice and think of others even when my pager goes off at 5:55. I cannot express how lucky I am to be married to my role model, who is living her dream as a pediatric hem-onc fellow at Dana-Farber. As the saying goes, the days are long and the years are short, and we will be reunited in a few short days. I owe my future career to those that have helped me along the way, as well as the training that Baylor has provided me. Congratulations to everyone graduating here today, and see you again soon. Thank you.
Great honor to introduce Dr. Daniel Chang. Throughout his years of training, he has shown to think outside of the box and be a problem solver. His patients greatly benefit from his dedication and expertise. He's very mature and has excellent work ethics. Daniel, best of luck in Stanford as a microsurgery fellow.
Hello, everyone. So it's been a crazy few months, and I think this is the first graduation where I didn't have to wear pants. But thank you for taking the time to join us anyway and to celebrate our achievement. And when I say our, I don't mean the names on the schedule or the diplomas, but I mean the achievement of all of you. Because without everything that you all have done, we wouldn't be here today. Thank you to all my colleagues and mentors that have brought me to this point. It's been a truly incredible experience to train at Baylor in the amazing Texas Medical Center. And of course, thank you to all my patients. I'm sorry we had to meet under the circumstances that we did, but thank you for allowing me to participate and learn from your care. And most of all, thank you to my family. Thank you for the love and support from my parents, who gave me the foundation to be where I am today. And thank you to my loving wife and daughter, who have been by my side through the highs and lows and give life meaning and purpose outside of surgery. My mom recently shared with me a proverb that says, if you want to go fast, go alone. If you want to go far, go together. I know it's because of everyone here with me that I've gotten this far. I look forward to how far we can go together. I'm excited for what the future holds. I'll take everything from my experience here and carry it onward to teach the residents, to care for the patients, and innovate in practice.
Great pleasure to introduce Dr. Christy Hamilton. Christy is an outstanding resident and has been since her intern year. She has been a role model, not only because of her technical skills, but also because of her positive attitude, compassion, and professionalism. She will be missed, but we're glad she isn't going too far. Good luck, Christy.
Hi. If you can all hear me, I'm Christy Hamilton. I've been at Baylor for the last 10 years of my life, which is almost all of my adult years. And it took literal blood, sweat, and tears to make it to this point, becoming a plastic surgeon, which has been a great dream of mine since I was a child. This accomplishment is not a testament to me, but rather to the people who have supported me, advised me, delivered me sometimes my only meal at 9 p.m. at night in the Bentop sat lot, thank you, and unconditionally loved me my whole life. My mom, my dad, my genius brother Ross, my grandfather, and a little later on, my boyfriend Harry. My brother, incidentally, is also graduating from Baylor with his PhD. I'm so very proud of you. So now there are 2 Dr. Hamiltons. To my teachers, the faculty, there are too many of you to name, but you know who you are. Yours are the voices I hear in my head when I'm operating. Yours are the techniques I refer to when I'm working out my approach for a patient's surgery. You have taught me to think like a surgeon and giving me the proverbial tools I need to be successful. Thank you. I am so grateful, and I will still be calling you for advice. Finally, to my fellow chief residents and to the current residents, thank you for being amazing partners on this incredible journey. You made residency fun, even the toughest parts, and we are forever bonded by this mutual experience. I am always here for you too. Thank you so much.
Hello, everyone. My name is Mark Mazziotti, and I'm the Program Director for the Pediatric Surgery Fellowship at Baylor College of Medicine and Texas Children's Hospital. I know we all wish we were at the Zaza tonight, enjoying ourselves and not social distancing, but here we are doing what we're doing. So we'll make the best of it, and I think we can still honor our graduates in a great way. So I have the honor tonight of talking to you about Raphael Sun, who is our 2020 graduate for pediatric surgery. Just so you know a little bit about him, he's from Virginia and attended the Medical College of Virginia at VCU. He also attended general surgery training at Washington University in St. Louis. I'm sure Dr. John Goss would agree that that institution trains some of the best surgeons in the world. I'm also a proud graduate, although I can assure you that that had nothing to do with Raphael matching at our fellowship. Let me tell you a little bit about him and his performance in the fellowship. As would be expected from a great WashU graduate, he's done exemplary, and he's really been a model of professionalism. His integrity is without question. He's one of the hardest working fellows you will ever meet, or hardest working surgeons you will ever meet. I've tried to send him home multiple times, and then you turn around and he's right there behind you. He's really devoted to the children and has been a tremendous asset and ambassador for our group. He's really been someone we're very proud to graduate, and he's done everything we've asked him to do and beyond. He's really excelled in his technical abilities, and he's also been someone who's been a great teacher to his junior fellow, to the medical students, the residents, and to the attendings as well. He's been fantastic to work with, and again, we are so proud of him and his accomplishments. He is going to stay with us for another year as an instructor in surgery and as a fetal fellow. I know he will do very well and excel in this very complex subspecialty. And I think that really fits his interests quite well. His wife, Lee, and his daughters, Lexi and Victoria, I know are very proud of him and his accomplishments. And I'm sure he will continue to impress them. I'm sure they will also be very happy with the fact that he'll be home a lot more than he has been in the past. So let me just say that on behalf of our entire faculty and the APPs and the residents he's helped train and the medical students, we congratulate Raphael on a exemplary performance and wish him the best in the future.
Thanks, Dr. Mazziotti. Just wanted to say thanks to all the faculty and the PAs for teaching me everything that I know. You've all been very supportive from day one, and I couldn't have done it without you. I also want to thank all the residents that have come through the program or come through the rotation. Again, this team is so large and busy, we just couldn't do it without you. I hope that you all learned from me as much as I've learned from you all. And also want to thank my co-fellow, my senior fellow, Ahab, and my junior fellow, Lily, for teaching me so much. I also want to thank my wife, who's been an incredible mother to our two children who both came during fellowship. And I want to thank my mother-in-law for staying with us, for helping us out, just because I am usually not at home. We just could not have done it without you. And lastly, I want to thank my mother and father who are no longer with me, but for all the sacrifice that they made for me to be where I am today. Thanks.
Welcome. I'm Joe Mills. I'm the Division Chief of Vascular Surgery and the Program Director for our Fellowship and Integrated Residency programs. I've been here 5 years. Today, I'm proud to introduce two graduates. First is Natasha Hansraj, who was born in Karachi, Pakistan, and graduated from Aga Khan Medical School, which is the premier medical school in the country. In fact, they accepted 90 students among 2,500 applicants. She then completed her general surgery training program, including 2 years of molecular research at the University of Maryland. She loves to travel, likes to hike, play water sports and yoga, and is an accomplished pianist. While in Maryland, she coordinated the training didactic sessions for general surgery residents, and her teaching has been widely recognized since she came here to Baylor. She's been described by our students and residents as, quote, an awesome fellow, very nice, a really great teacher who invested time in me and showed interest in me as a student. She trained at a nationally renowned Baltimore shock trauma unit, and she loves to dive into open surgical operations. In fact, some of the faculty affectionately call her our trauma surgeon. She is always positive, her enthusiasm is infectious, and her drive to always be learning has been much appreciated. We are proud to welcome her to our division as a new faculty member, where she'll go to the Michael E. DeBakey Veterans Administration facility and join Dr. Kugias and Dr. Barshis and help us expand our teaching modules for medical students and general surgery residents. Her clinical interests are complex limb salvage procedures. Congratulations, Natasha.
Hi, everyone. I'm not sure if everyone can hear me. Sorry, I think I was supposed to go before Courtney, but this is Natasha Hansraj. I just wanted to thank everyone. I wanted to thank everyone, all my attendings, who have helped me through this journey, which is just 2 years. And while in length it may be long, but the actual time just vanishes really quickly. And for attendings to give us that time and that energy to teach us this vast variety of open and endovascular skills and decision making, and be amazing mentors and friends. I just want to thank them for all their energy and all their efforts, and for welcoming me to part of the BCM vascular surgery family. I would also like to thank all the general surgery, vascular surgery residents, all my junior and my senior fellows, without whom this journey would not have been as smooth, and they've been extremely, it's been an honor. So I just want to overall say I want to thank everyone, and it's been an honor to be a part of this vascular surgery team, much like what Courtney said. Thank you. Oh, I'm sorry. And lastly, I'd like to thank my family, my siblings and my mom for bearing with this long marathon and the ongoing race that continues. Thank you, everyone.
So proud to introduce our other graduate, Courtney Grant, who's a native of Augusta, Georgia. She completed her undergraduate education at the University of Georgia in Athens, Georgia. Before going to medical school, interestingly, she taught high school biology for 2 years at an underperforming high school in Houston as part of the Teach for America program. And in fact, during that time, she won a district teaching award. She subsequently matriculated to the University of North Carolina in Chapel Hill Medical School, where she was a recipient of a Board of Governors scholarship and also was selected for the Eugene S. Meyer Community Service Award. She then completed her general surgery training at Inova Fairfax Medical Center in Falls Church, Virginia, interestingly the alma mater of another one of our recent graduates, Eli Kafuri. She also, like Natasha, excels in teaching and was the lead instructor for weekly medical school didactics while she was a general surgery resident in Virginia. Before she joined us, she had performed significant medical volunteer work both in Tanzania and Venezuela. She has also been described by students and trainees here at Baylor as a great teacher who is great with patients and, quote, an awesome resident. I do think Courtney has been homesick for her family in her native state of Georgia, and after graduation, she will join a busy private practice group in Gainesville, Georgia, not far from her home. Vascular surgery is indeed a small world, as the senior partner in the group she will be joining was a close contemporary of mine while I served in the United States Air Force in San Antonio. Congratulations, Courtney, on what I know will be a joyous homecoming where you will carry with you your excellent training, positive attitude, and deep caring for others back to your home state.
Thank you so much, Dr. Mills. And to all of the faculty and the staff and the nurses and the administration at Baylor, just for your investment in my education. All of your time and your effort with me, very much appreciated. Dr. Mills, Dr. Chung, Montero Cugias, Dr. Liu, Dr. Barshis, I will not only walk away with mentors, but also friendships, I believe, that will last me a lifetime in this career. So thank you so much for your time and your teaching. I also, of course, would like to thank my family, without whom any of this would be possible. Thank you for your love and your support. I want to also give a special recognition to all of the other and my fellow first generation college graduates who are graduating tonight. I don't want to lose the magnitude of what it means to be able to go through this journey without a blueprint on how it is to be done. So congratulations to you too tonight. And finally, as the first Black woman to complete the vascular surgery program at the Michael E. DeBakey Department of Surgery, I just am completely honored and would like to continue to challenge this department to continue to recruit and support people of color for faculty positions, staff, trainee positions, so that we can continue to diversify the face of medicine and reflect the community that we serve. But with that said, it has been an absolute honor to be a part of the legacy of the Michael DeBakey Surgery Department. And thank you to all of my teachers, mentors, and friends.
Hi, I'm Jeremy Ward, Program Director for the Surgical Critical Care Training Program. It is my pleasure to introduce to you today the 4 graduates we have from our Surgical Critical Care program. Diana Ariano, Chris Gidry, Johnson Yee, and Sarah Fallon. It has been a pleasure working with you all this past year. On behalf of our faculty, we wish you the best of luck, and we thank you for your service. Congratulations.
Hi, everyone. First of all, congratulations to my fellow graduates. I wish you all luck for your future. I want to thank all the nurses, all the support staff from the ICU to the education office for all your help throughout the past year. Of course, I want to thank the attendings for all your teachings, specifically Dr. Ward, who took over as program director seamlessly. And lastly, I want to thank my family and my co-fellows for the amazing support you have given me.
Good afternoon, everyone. Congratulations to all the graduating residents and fellows. I would like to thank my wife, my parents, my brother, and my entire family for all of their continued support this year. I would like to thank all of the surgical ICU faculty for all of their guidance and teaching throughout the year. I have had a great experience and would recommend this program to anybody interested in surgical critical care. I have learned so much this year and plan to use the new skills I learned in my future practice. My wife, stepdaughter, and I are excited to move to our new home in South Carolina, and I look forward to starting my new career this September. Thank you all once again, and congratulations to all the graduates.
Hi, this is Sarah. I would like to thank everybody for going through my third graduation with the Baylor Department of Surgery. I would particularly like to thank all of the TCH faculty, especially including Adam Vogel and Dr. Alan Milowitz. I actually started my intern year of general surgery in the Ben Taub Surgical ICU in 2009, and I think the way the ICU currently functions and is run is an amazing testament to Doctors Ward, Vera, Wilson, Davis, Sulliberg, Scott, Gordy, and Dr. Hoffman. It's an amazingly run area of the hospital, and I appreciate all of the learning and teaching that I received from your group during this year. Thank you.
Good evening. Congratulations to all the graduates. My name is Chad Wilson. I am one of the trauma surgeons at Ben Taub, and I have the distinct pleasure to introduce Dr. Sai Khanda, and am honored to be the person to announce that he is graduating from his surgical residency. Dr. Khanda, like all of our graduates, is very smart. He's hardworking. He's a good doctor. But I want to say some things about him that are unique. Dr. Khanda, I met approximately 4 years ago when I came onto faculty here. And we immediately established a relationship, a bond, if you will. I'd probably say it's very much a fraternal bond. And I see Dr. Khanda as my little brother. And like a little brother, he was faithful. He would always try to help me in any circumstance. And I was careful to do my very best to be a good role model because I knew he was watching. And also like a little brother, he often darkened my door frequently, wanted to just talk and hang out. But I didn't mind because, frankly, I found Sai to be a man of great introspection and great integrity, always looking inside and trying to find out if he was doing the right thing for his patients, if he was doing the right thing in terms of how he was dealing with his colleagues or any problem that came along. He took every process seriously, and I have been very impressed by Dr. Kanda throughout his residency. It's really been a pleasure to watch him mature and become as skillful a surgeon as he is a wonderful human being. So, Sai, congratulations and good luck in Minneapolis.
All right, well, I hope everyone can hear me. First of all, I want to thank you, Dr. Wilson, for the kind words. I'd like to first start off by thanking my family. Couldn't have been here without all you guys. I'd like to thank my friends, all the current and past residents who have been mentors to me, patients, nurses, attendings, and countless other individuals who've made this journey possible. I truly couldn't have done it without all you guys. Although this is the end of training, in many ways, it seems far from it. Looking forward to the next step in the journey, and we'll continue to strive to be better. Thank you again.
Good evening. My name is Oluyinka Olutoye. I'm Surgeon-in-Chief at Nationwide Children's Hospital, but still maintain an adjunct professor appointment at Baylor College of Medicine in the Department of Surgery. It's my pleasure to introduce to you today Dr. Patricio Lau. On a day like this, where we celebrate the successes and achievements of our fellows and residents, it's important to take a step back and evaluate the tailwinds and headwinds that they had to contend with to get to this point. You see, Patricio is one of those that had to overcome considerable headwinds to get here. Born in Nicaragua and emigrating to the United States at the age of 15 with his family, Patricio was the first in his family to go to college. He did an exemplary job in college, finishing with 2 degrees, and continued into medical school at the Florida International University. He distinguished himself also in medical school and was fortunate to attract him to the Baylor College of Medicine General Surgery program, where he has spent the last 7 years with us. During that period, he spent 2 years in my laboratory working on research related to necrotizing enterocolitis and other issues. Patricio also exemplified himself in that endeavor and secured local and national awards. As a result of his effort, Patricio was able to secure a coveted position in Pediatric Surgery Fellowship at the Nicholas Children's Hospital, where he will be starting next year. You see, in spite of considerable headwinds, Patricio has been able to overcome and succeed in his endeavor. We're indeed proud of him and delighted for his achievements at Baylor College of Medicine, but we couldn't even be prouder than his wife Anais, his sons Rafael and Patricio Jr., and his entire family for his accomplishments. It's therefore my pleasure and honor to introduce to you Dr. Patricio Lau.
Hello, thank you everyone. Thank you, Dr. Alter, for the kind words. More than anything, I want to thank my wife Anais for staying next to me all these years, all these long years and the long hours that I spent at the hospital. Beautiful children, Patty and Rafi. A mi madre, gracias a ti, todo esto pudo ser posible. My brothers and sisters have who made me so proud, and to all my family who has helped me through all these years. I want to also Dr. Latoye, who you have not only been a mentor to me, you have been like a father figure to me. To all the faculty at Ben Taub, the VA, and in St. Luke's, you were great mentors and great to learn how to become a surgeon. Especially to all of the faculty at Texas Children's for your guidance through all this time to help me accomplish my dreams to become a pediatric surgeon. Thank you so much to every single person at Baylor for helping me to be who I'm, to achieve my dream. Thank you.
Good evening. This is Rob Todd. I'm currently in Atlanta, Georgia, where I'm Senior Vice President and Surgeon-in-Chief at Grady Health Systems. It's my absolute pleasure to introduce you to Tashinga Musanta. From day one, Tashinga has been the consummate resident. Be it his preparedness for the day, his insightful questions in nature, or his dapper suits, Tashinga has always been on point. I had the pleasure of getting to know Tashinga not only as a resident and clinician, but also as a researcher, as a mentee, and most importantly, as a friend. Following completion of his residency here at Baylor, Tashinga will be going to Colorado Springs, Colorado, where he'll be going to private practice and subsequently joined by his fiancee, Laura Trujillo. Congratulations, Tashinga.
Okay, thank you, Dr. Todd. I really appreciate the introduction. I think my story was unlikely if I had not had allies. And I'm here today because of my family, my friends, my sponsors, Douglas, with the responsibility to the college to the conference in Zimbabwe. And I hope at this point in time in our world that we will all remember to be kind to one another. And I hope we all share my belief that there's always going to be light at the end of this tunnel. We'll get through this pandemic stronger, and we will find racial justice in this country and in the world. Thank you very much.
Well, good afternoon. I'm here to share a little bit about the next graduate, Dr. Eric Racklin. For those of you who don't know me, my name is Rami Delani, and I'm one of the surgeons over at Ben Taub. And my relationship with Eric started our first meeting where we actually ended up writing a paper together. And then as a second year, so when he was coming to me as a fourth year, I had a lot of anticipation and trepidation. And all I had to do was give him the needle driver. And boy, did he run with that. Then I had to distract him. And being a Houston boy and a jock, that was pretty easy. I just had to talk about sports, particularly Mike D'Antoni. And boy, would that get him distracted. And then I had to rescue him. And one time I had him distracted and running, and did he get himself into some trouble? So I didn't make a big deal out of it. I just bailed him out, and we carried on, but I earned his trust. And the other thing that he learned is that there are no home runs in surgery. A lot of singles, walks, and an occasional hit by a pitch. So that was the foundation of our relationship. And it was a good relationship. It was so good that he came to me after his first term and asked for a second term. I was wondering, God, what did I do wrong? But nevertheless, we took care of a lot of patients together. Many of them will forget. Some of them we want to forget. And there's a few of them that we'll actually remember. Like the guy whose aneurysm we fixed, and Eric made me buy lunch for everybody, even though I won the bet. But that's just the way Eric is. But I'll finish with one final word for you, Eric. There are no whispers in surgery. Once you finish, it's all up to you, my friend. You're talented, you're passionate, you're self-reliant. So when you find yourself in that Super Bowl one day, I want you just to stop and whisper to yourself and make us all proud, like I know you will. Congratulations, good luck, and Godspeed, my friend.
All right, thanks, Dr. Galani, for those kind words. I really had a great time working with you. Those 12 weeks while a surgeon. I learned how to get into trouble, and I learned how to methodically get out of trouble. And even though I totally misquoted you when it came to there are no home runs in surgery in front of the entire department, that's some wisdom that's always going to stick with me, and something that I really think has helped me through the remainder of my training and hopefully throughout the rest of my career. Along the way, I wouldn't be here if it wasn't for you, for your guidance, for your words of wisdom, for putting up with my recklessness and my combativeness and my sarcasm and everything else that came along with it. But thank you for everything. It's really been an honor to be at Baylor for these last 9 years. Thank you to all the junior residents and you, and I've learned as much from me from you. And then most importantly, I'd like to thank my family. I'd like to thank my parents for dealing with all this and being a great source of support. I'd like to thank my brothers for thinking I'm totally insane for going through this route and making fun of me every step of the way. And then most importantly, I'd like to thank my wife, Shauna, and my daughter, Sydney. Putting up with the hours, putting up with the frustration, putting up with everything that came with it. If it wasn't for y'all, I wouldn't be here today. Thank you for everything, and thank you for this awesome opportunity.
I'm Dr. Stephanie Gordy. I'm one of the Bentab Trauma and Acute Care Surgery faculty, and I have the privilege of introducing Dr. Laura Trujillo tonight. I have known Dr. Trujillo since she was an intern, and I've had the privilege of seeing her grow into a mature, competent surgeon and leader. Dr. Trujillo will be leaving us and going to Portland, Oregon at OHSU, where she is doing a 1-year surgical critical care fellowship. And Dr. Trujillo will then move to Colorado Springs, where she is joining another acute care surgery group at the St. Francis Hospital in Colorado Springs, Colorado. I know that I speak for all of us when I say we will miss you, Dr. Trujillo. You've been an outstanding resident, and we look forward to seeing your career flourish.
Well, it's incredible to be here. I want to thank everyone who has supported me through these 5 years. To my parents and the rest of my family, thank you for your unwavering support and your understanding, even when I couldn't be as present as I wanted to be. To Tishinga, thanks for sticking with me through all of this, through the ups and downs, and loving me despite all of it. I promised I wouldn't cry. To my friends and my co-residents, you guys have helped me through some dark days and become my family. I couldn't have done it without you. And finally, to the faculty here at Baylor, particularly the faculty at Bentab, I'm the surgeon I am today because of you and your guidance. I'm well prepared to face the challenges that come next. So thank you.
Hello, my name is Drew Davis, and I'm an assistant professor of surgery here at Baylor College of Medicine. I work as a trauma surgeon at Bentab Hospital. I came here from Atlanta, Georgia, where I trained at Emory, and I say that because in my residency, I trained with a colleague who was from Puerto Rico, and she was the smartest, most energetic, feisty, and unpredictable individual I had ever met up to that point in my life. And I thought I would never meet anyone else like her. And then I came to Baylor and met Nicole Villafane. Nicole, during my time here, I know I speak for all of us when I say what an honor and a privilege it has been to work with you and train you and watch you grow and mature in such a fabulous fashion. You have done great things here, and great things are in store for you. Working with you at Bentab has always been fun. It has never been dull. And clearly, your excellence and grace as a ballet dancer, which you share with us during your grand rounds, are only surpassed by your dedication to the field of surgery and the compassion you show your patients. I'm very excited for you as you embark upon this new part of your journey coming up to become a very talented and gifted surgical oncologist. You truly represent all the very best of the Baylor College of Medicine General Surgery Residency Program, and we are so very, very proud of you. I know you're going to do great things. Amazing things are in store for you, and I know you're going to keep in touch along the way and keep us all informed about it. Much love to you always. All the best to you, and best of luck.
Well, I don't know if everybody can hear me. Let's see. Well, good evening. Thank you, Dr. Davis, for your very kind words. I would like to thank all the Baylor faculty, the NPs, the PAs, the education team, and of course my co-residents for being part of my growth as a surgeon and an individual for the past 7 years. I would also like to thank my Houston family, Amy and Jason Wood and Caroline Hadley, because you have always been there for me throughout residency, and especially now when I'm particularly homesick with COVID and being very far away from my family. Most importantly, I would like to thank my mom and my dad for always believing in me, even when I didn't believe in myself. I love you and I miss you. And I wish you guys were here. Lastly, I would like to congratulate all the graduates. And of course, all of my graduating class, all of you guys, I love you very much. And it has been an honor to be part of the Baylor family. Thank you.
Hi, this is Hop Trankow. I'm a surgical oncologist over at MD Anderson, but I had the great fortune of starting my career at Baylor and at the Michael E. DeBakey VA Medical Center. What's the greatest thing about Elaine is that she has a heart of gold. She really does. She cares so deeply and passionately about her patients that she'll always do the right thing for them. And that's why I know she's going to make an outstanding surgical oncologist once she finishes her fellowship at Fox Chase. Elaine, on this evening, on your graduation, I just want to let you know I could not be more proud of you. I'll always be in your corner. I'll always be rooting for you. So I joined the Michael E. DeBakey Department of Surgery and your parents and your family and your peers in congratulating you and in wishing you the very best. So Elaine, and to the rest of the graduating chief residents, congratulations. Enjoy yourselves tonight. You've earned it. And take good care. Bye-bye.
Can you see me? Oh, okay, there you go. Okay, thank you, Dr. Trankow, for those kind words. I still can't believe I'm finally graduating after a decade of being here at Baylor for medical school and then for residency. Congratulations to all the graduates. Very proud to share this day with you. So I have many people to thank. First, my parents, mom and dad, Gamang Bamea. All of my accomplishments like today, I share with you. To my sister who has been there for me through my ups and downs. To my husband, David, who has fed me and part of our class, packing our lunches and making smoothies. I wouldn't have made it without you. And then, of course, I have my other extended family, my aunts and uncles, my cousins, the Heartbreakers. Then, of course, I have to thank my co-chiefs, all the residents, the faculty, the nurses, the nurse practitioners, all the staff at all the hospitals. This residency has been a family for me. So thank you again for teaching me and helping me grow.
Good evening. My name is Monica Lopez. I'm an associate professor of surgery and pediatrics and director of clinical research quality and outcomes at Texas Children's Hospital. It is an honor and a privilege to introduce our graduating general surgery chief resident, Dr. Yang Yu. Yang, we are immensely proud of all your accomplishments as a surgeon and as a clinical research scholar. During her training years, Dr. Yu distinguished herself with a strong work ethic, solid fund of knowledge, and excellent technical skills. She was always valued as a team member because of her clinical judgment and the keen attentiveness to the well-being of patients that she displayed with enthusiasm and diligence in problem solving. Dr. Yu is a graduate of the Baylor College of Medicine Clinical Scientist Training Program and received a Master in Science degree in clinical investigation. Her thesis was focused on evaluating the cost utility of surgical management strategies for infants with gastroesophageal reflux disease, which is a highly debated topic in our specialty for which data are urgently needed to inform practice guidelines. Her work also received national attention when she applied the time-driven activity-based costing methodology to understand inefficiencies in care and to deploy value-generating interventions for pediatric appendicitis. Locally, Yang's work laid the foundation for our institution to pilot a shared savings alternative payment model for appendectomy in conjunction with our own health plan, which led to being able to deliver value-based surgical care for this very common condition. We are fortunate that Yang will remain at Baylor this next year to pursue a surgical critical care fellowship. We look forward to tracking her career. Yang, we know we're certain that you will make impactful contributions in our field, both as an exceptional surgeon and a future standard bearer for outcomes and value-based surgical care research. Please join me, the entire pediatric surgery faculty, the Yu family, including baby Amelia, in congratulating Dr. Yang Yu.
Good evening. Thank you, Dr. Lopez, for all your mentorship over the years. 32 years ago, my parents came to this country seeking a better future for their family. They gave up their careers in oceanography and nursing to start all over again, from bussing tables to taking a chance and opening a booth in a flea market, and over the years growing this into a successful small business. Their dedication perseverance, and sacrifices allowed me to succeed and taught me so much about the importance of hard work. I'd like to thank them for supporting me all these years and providing me with the tools to succeed. I'm proud to be the first doctor and today surgeon in our family. These 7 years of residency have gone by much quicker than I thought. During this time,
So now we go to the award portion of the night. Our very first section is going to be for our medical student awards, and our associate clerkship director, Ron Cotton, is going to present those awards.
Good evening, and thank you, Dr. Scott, who is my program director. And as an alumnus, I'd like to congratulate all of the graduates today. It's quite an honor, and it's a very exciting time for you. So on behalf of Dr. Gordy, who is the director of UME programs for our department, and Woods McCormick, who is our coordinator, and the entire team, I'd like to present 3 awards tonight for our medical student program. First, to an outstanding student in surgery. The new Dr. Ryan Jacobs is the recipient of this award. Dr. Jacobs did an extraordinary job. He was one of the chairs of the Student Surgical Society. Dr. Jacobs today is preparing to start his residency, so he may not be joining us tonight. I hope he enjoys his evening because tomorrow will be a different day. So congratulations, Dr. Jacobs. I'd like to next move along to Outstanding Teaching Award from our medical students to one of our house staff. This award goes to Dr. Kevin Huang, who is truly an extraordinary teacher and extraordinary resident. In fact, he is currently performing life-saving surgery in the transplant division, and I'm not sure if he is tuned in. I tried to subtly tell him to log in, and he may not be here because he is saving lives. So, Dr. Wayne, congratulations on an outstanding job. And finally, I would like to offer congratulations to a faculty member who has exhibited outstanding efforts towards teaching our medical students. This goes to Dr. Van Buren, who's one of our faculty in the Division of Surgical Oncology, who is present. So Dr. Van Buren, on behalf of the entire UME program, congratulations.
So the next few awards are actually for the general surgery program. The Outstanding Intern Award, we survey all of our residents and say who's the best intern for this year and who is the chief of the year. So Outstanding Intern of the Year award goes to Dr. Andy Espinoza. We're seeing if Andy's actually on. And then the Outstanding Chief Award goes to Dr. Elaine Vo. And I know Elaine is, I don't know if she's still on, if she wants to say anything. She's not on anymore. So now we go on to our Outstanding VA Chief Award, where Dr. Louisa Chu has a taped introduction. Before we go to the residents, we're actually going to have a correction. If you see the McCullum Award actually goes to Laura Trujillo. So my script was wrong, but the slides are correct. So Laura, congratulations. And we're going to move on to our next award. Is actually given by the general surgery chief residents that are going to give a faculty mentor award.
Good. Okay. Well, congratulations to all our graduates and certainly to our awardees as well. The two remaining awards are both of considerable significance. The George Noon Award, which was begun about 7 years ago and is one of really the cornerstones of recognition in our department. The cadre of prior recipients are truly icons in our department. Have included Dr. Goss, Dr. Maddox, and Dr. Sugarbaker. This year's awardee is truly a perennial stalwart and an anchor of our department. To me, he's in many ways the conscience of the department. Is certainly my conscience. Anytime you need to get the job done, this is certainly one of the people I turn to, and has personally been a source of tremendous support in my own times of need. It feels that he's been here forever, although I know it hasn't been that long, but he truly represents the fabric of the Mike Lee Department of Surgery and what our department means in terms of our culture and our sense of family. Just so happens that he happens to be here today, and I am honored to recognize Dr. Eric Silberfein as our 2020 George Noon Professionalism Award. So Eric, if you can take off your mask and come on up. Wow. I'm stunned, and I'm truly honored, Dr. Rosengart, and the department for this award. It's anybody that knows me well knows how much this department means to me and how it shaped who I am. I'm extremely proud to be a graduate of this department and continue to be a member of the department. But you know, tonight is really about our graduates, and I can remember 11 years ago my night of graduation, and I just want to tell the graduates tonight that you need to take some time and reflect upon your accomplishments and your time here. 5, 6, 7, 8 years, some of you, Dr. Wu, I'm thinking of. But this is a tremendous accomplishment for you guys. Going forward, you'll hopefully look back very fondly, as I do, of your training here at Baylor, and realize that you're always part of our family here, and always we avail ourselves to you guys to get in touch with us when you need help. But thank you again, Dr. Rosengart, for this honor. Thank you. Thanks. I'd give you your award, Eric, but it's virtual, so. Our last award is truly the most distinguished award in the Department of Surgery that we give out at any time during the year. It's the DeBakey Distinguished Service Award. It is the longest standing award that the department gives. And typically it's given for those who have served the department for a considerable period of time, and in part it's a reflection of the longevity of service. In this case, it is truly a reflection of the significance of the service. And in one of the more unusual of circumstances, it has only happened rarely in the history of this award. This year we're awarding it to 2 people because both have contributed in a way that is inseparable from each other in terms of making that selfless contribution that truly marks this award and truly marks the highest values of the department. As I said in the beginning of the evening, this year has been marked by our all needing to rise to a challenge and testing our mettle and defining who we are. And the nominating committee, which is our faculty appointments and our promotions committee, not only unanimously, but almost immediately recognized these 2 individuals for their leadership and a selfless devotion to the cause of taking care of patients and demonstrating great service in the name of our department and their role as surgeons. So I'm honored to announce Dr. Michelle Lohr, our Chief of Surgical Intensive Care Unit, Baylor St. Luke's Medical Center, and Dr. Robert Southard, our Chief of Acute Care Surgery, for their contributions, not only taking care of our patients and the critical care units during the COVID crisis, but truly for your modeling great leadership. So to Michelle and Rob, congratulations and thank you for your great service. Do we have them online? Great.
Work with Dr. Lohr, Dr. Rojas, Dr. Tonova, Dr. Hoffman to see them learn how to take care of these patients when none of us really knew what was going to happen was just one of the most remarkable things I've ever had a chance to do in my career. Thank you.
It'll take me a second to get my thoughts together, but I will say that, you know, it's really about the team, and I'm so thankful to have the other attendings that I work with. And, you know, as I was sitting here listening to graduation, I was thinking about how brave and courageous the residents were who really stepped up to help us. And I will always remember them for their contributions to the ICU, you know, helping out or even asking how we were doing. Even words like that were just helpful. And I congratulate all of them as they move on. And thank you for this award. It's great to be recognized.
I think we did it. It was a great evening, and we wish all of our graduates and awardees a great evening celebrating with your friends and families, and best of wishes going forward. That concludes our ceremony. Thanks for those who are able to attend in person. And again, great evening and congratulations to all. Good night.